Hello, everyone. Welcome to another Tuesday Talk. I'm so happy that all of you could come. Today, I want to especially thank our sponsor, AARP Driver Safety, for all they've done for us in the past and continue to do for us at Always United. Now, Always United has a new director named Adena Rice. She's here today. There she is.
Hello.
We're very happy to have Adena. For a long time, we've been under the guidance of Claudia Brooks, and I'm happy to tell you that although Claudia retired, she has stayed with Always United, and today she's going to be the moderator for the panel discussion that we're going to have. She's also volunteered to be chair of our activities committee. So here's Claudia, and we'll continue with the program.
Good lunchtime, everybody, and thank you, Liz. And I'm so glad Adena's taking over. You're in really good hands there. And I'm excited about our panel today. We'll be discussing the work of United Way and our special partners, working towards the mission of promoting health, financial stability, and education in this community. Each panel will focus on the work that's being done because of and during this pandemic, and how you can support them in their efforts. And what I'm going to do is we have 4 panelists: Goodman, Cheryl Johnson-Benjamin, Craig Currey, and Kimberly Issac. What I'm going to do is introduce each one separately and ask them to briefly let us know what they are doing with this work. To start with, to give you an idea of their different organizations and how they play in those. And then what we will do is ask questions, and we invite you to ask your questions online in the chat box. We'll bring them up as we come along. So I'd like to first welcome the newest member of our group, Goodman. And Andre has just joined United Way of the Midlands in the last few months from the University of South Carolina Athletics Department, where he worked with student athletes to enhance their academic and personal journeys. He's also a graduate of the university and a native South Carolinian. In his job as youth program manager, and Andre leads the Empowerment Action Coalition to build productive and protective factors, coordinates the Resilient Richmond awareness events, and conducts adverse childhood experiences training. Andre, we really appreciate you being here, and tell us a little bit about this work.
Yes, ma'am. Thank you for that introduction, Claudia, and thank you for having me a part of your panel. So I'm in charge of coordinating Resilient Richmond, which is a coalition of agencies throughout the Midlands that work to bring awareness to adverse childhood experiences and the effects of it. Those experiences include physical, sexual, and verbal abuse, as well as physical and emotional neglect. Through targeted training and community awareness events, we hope to create a more informed Richland County. Just by equipping individuals and also organizations that work with children with information and skills to help build resiliency throughout our youth community, with the hopes of providing children with the proper support to cope, adapt, and rebound from those early traumatic events.
Thank you. And we'll see you back in a moment. And then the next person I'd like to introduce is Cheryl Johnson-Benjamin. And I've had a good time working with Cheryl for quite a number of years. Cheryl is a native South Carolinian, and she does have 39 years of experience in health and human services: budgeting, contracting, procurement, auditing, accounting, grants management, program development, and monitoring. So she's had her hands full with this. In her current position as Senior Director of the Health Council, Cheryl works to address all the activities with the health needs and analysis programs development, financial resources development, funds allocations, and outcomes for evaluation of the Health Council. Cheryl, thank you, and give us a little more information about specific programs to the Health Council.
Okay, awesome. And thank you for the opportunity to share today. I'm going to speak about one of our initiatives that is very critical to meeting the needs of our uninsured and underinsured population in our community, and that is our Well Partners Dental and Eye Health Clinics, which are located in Richland County, inside the Richland County Health Department, and another location out in the Red Bank area of Lexington, located inside the Lexington County Health Department. And these programs provide much needed dental and eye care services to not only the adults, but our children. And it is a unique partnership with our hospital systems, Prisma Health, Lexington Medical Center, a host of volunteer dentists, residents, internists that comes through our doors to help us build capacity to get folks served. And folks walk out, some with their lives changed because one, they're out of pain. For some, they're able to get back to work. And especially for our school age children, we're able to keep them in class without missing instructional time because of a toothache.
Thank you, Cheryl. We really appreciate that and look forward to having you answer some questions.
Okay.
Next, I'd like to introduce Craig Currey. He is a retired colonel and with the U.S. military, and I wanted to really thank him because he actually does very much hands-on work every day. He's the president and CEO of Transitions, and it's the Midlands' largest homeless center located in Columbia. He began that work on April of 2012 after retiring from a 33-year career in the U.S. Army, and he was highly decorated. Has the Distinguished Service Medal, Legion of Merit with Oak Leaf Clusters, Bronze Star Medal, Ranger Tab. I can go on and on. Craig, we thank you for all the service that you did. And we're so glad that you retired here and decided to stay in Columbia, South Carolina, and take care of the people that you do. Can you tell us a little bit about Transitions?
I sure can. Thank you, Claudia, and thanks for your kind words. Columbia is a great place, and Transitions and United Way help to keep it a great place. Transitions is a homeless center for adult men and women. So 18 or older, we will take you. We have 260 beds, and we're located right on Main and Elmwood. You actually enter the facility from the Calhoun Street side of the building. So we're right downtown, lots of homeless folks, lots of people in need. We've helped 2,817 folks move into permanent housing since we opened in 2011. And United Way helped us initially quite a bit. They still do. But people like Mac Bennett were very instrumental in forming the facility, designing it, and helping to create it. So if you're wondering, well, why Transitions, we do the lion's share of homeless for adult homeless folks. We don't do children. So those are other organizations that partner with United Way as well. But we stay very engaged, very involved, 216,000 meals. We have 50 plus partners. So those meals were served with the Salvation Army's help. And we've got a lot of partners here who make things possible. Mental health wise, we're at about 38% who admit serious mental health issues. We've got people, United Way partners like Mercy, Columbia area mental health that come in. Substance is about 1 in 4 have a serious issue with addiction problems, and Loredac will come in and help. So it's a team effort, and we're really trying to help get homeless people off the streets. We touched 3,397 people last year across the Midlands. So lots of homeless people. I say that number to sort of give you an idea of the scope of the issue in the Midlands. And that's enough, Claudia. We'll save some for later.
Thank you, and thank you for the work that you do in that very important sector of the community, and that work and helping United Way its mission to make help people in a homeless situation. And finally, I'd like to introduce Kimberly House. Kimberly, I've had the opportunity to work with too, and actually doing some MRC volunteering. Kimberly is the Midlands Reading Consortium Director, and she has really seen this program go. She's a graduate of Columbia College, and her major was social work. And she spent the last 28 years working with children and families in the Midlands and in the North Carolina area. For the past 22 years, Kimberly has been an avid community volunteer, mentoring single parents, children, and providing support to families. Kimberly really believes that we're morally obligated to help those in underserved communities by giving our time, talent, resources to uplift families. And she does this every day in her work that runs more than any kind of work day that most people have. So thank you for being here.
But thank you for having me. I truly appreciate the opportunity. The Midlands Reading Consortium is a volunteer tutoring initiative where we recruit, train, and manage volunteers to work with students one-on-one once a week for 30 minutes. And those students are in grades pre-K through second. We function in 8 school districts, 27 schools between the Lexington, Richland, Newberry, Fairfield, and Orangeburg counties. We not only offer one-on-one tutoring, as we know academics is very important and we want to help our students to read proficiently by 3rd grade, but we have an umbrella of services in the arena of social and emotional support. We have 2 programs called Blossoms and Bow Ties that offer social and emotional support and leadership. It's somewhat of a leadership group for kids in grades 4th and 5th. We also like to collect new books to give to our students because we want students to have a library of books. I mean, of course, they're able to get books at school, but we want them to have a library of books at home. And we also offer parent engagement, working with families to let them know that they should equally be involved with the academic process of their child. But not only that, to give them tools and resources so they can work with their children at home. So that's what the MRC program, the Midlands Reading Consortium, is all about.
Thank you, Kimberly. And if we could have all of our panelists back on screen, we'll start talking about some of the work and how it might have changed since all of our lives changed back in March with the call to go home. I know we at United Way are back in the people at United Way are back in the office on a scheduled basis. And some of our partners have gone back to work and others have not been able to. And then the businesses and people who support us, everyone's lives have changed. So if you could all talk about what's changed in your program and its operation since the advent of COVID-19. And Cheryl, why don't we start with you?
Okay. Well, what we saw at Well Partners Adult Dental and Eye Clinic and our Children's Dental Clinic, this would have been around mid-March. We actually closed our clinics due to COVID and had to reassess what we needed to do to get back in operation. How do we keep our employees safe, and how do we protect the patients that were coming in? So after consulting with looking at the CDC guidelines, the American Dental Association guidelines, the American Optometric Association guidelines, and the local chapters, we were able to come up with what we call a comprehensive plan that was required to be signed by all of our employees and implement that plan to keep everyone safe. So we opened the adult dental clinic around the 1st of April. We started out very cautiously, only providing emergent care for the adult population. Because schools were closed as well, we made sure that our school nurses and the schools knew that we were providing the same for our children, which is emergent care. But we didn't have any patients coming in for those services on the children's side, and we can understand why. But we did have adults gradually coming back into the clinic. And then around mid-April, we had worked out all the kinks to ensure safety for all concerned, and we went back to providing full services for the adult population,
Okay.
using a lot of the PPEs and other protective measures, social distancing. And the good thing about it is that located inside of the Richland of the health departments, they do checks. So everyone coming in had to have their temperature checked, wear a mask, and be escorted into our clinics. So protection for all those involved.
Thank you, Cheryl. Craig, I bet that was a big issue for you.
It was a very big issue. And the thing to emphasize to the folks listening is we never closed our doors, nor did we turn people away. So the facility remained completely open. Now you say, well, how could that be? Well, the homeless folks don't really have any place to go. So if you shut the doors, they could go sleep under the bridge. But I mean, there's no viable option there. So we stayed open. The staff stayed present. We went immediately to mask and made mask required for everyone. A local church, their folks were making masks nonstop. And I sort of knew them and they knew me. And the next thing we know, we were passing masks out all over the place. So masks were a key thing early on, and I really think it helped us adapt well. We had to buy the thermometer, I call them thermometer guns, but the temperatures that can measure people's foreheads for their temperatures. Those were procured. And so we started screening people at the CDC guidelines of 100.4 or higher. And so that helped limit folks. And we developed, with United Way's help, a process with Prisma and DHEC to have a team come here and test people that had the temperatures. So if you had the high enough temperature, we called the MIH team, Mobile Integrated Health Team, and they would come to our front entrance where the client was waiting and test them. And then from there, they would develop in a few hours the results. If it was positive, we would get a hotel for the person through DHEC, and then they would do their isolation away from the congregate setting. That's worked for three folks. Three folks in the several months that we've been involved since March have had positive readings at Transitions, and we've been able to get them to hotels and away from everyone else. So that's a good news story as well.
That's a great news story.
Lots of hand sanitizer, lots of social distancing. We feed in shifts so that there is no line. We also feed in to-go boxes, which helps reduce the lines, but I'm afraid creates garbage, which is not what we like. But right now, we look forward to the day we can go back to plates and metal forks, but we're using plastic flatware and the to-go boxes. And so people don't have to wait. They don't bunch up. The elderly and those in wheelchairs and walkers sit at socially distanced dining area chairs. They're not allowed to move the chairs. We put the chairs where they need to be. And other folks go out in the courtyard and spread out and eat there as well. We've opened the dorms back up early too, so people can distance in the dorms without everybody bunching up outside or what have you. So lots of social distancing, lots of change. You have to change habits of people. They're very used to the way they do things. And so anytime you change the way you do a meal or the way you have to stand on lines that are painted on the sidewalks, that gets people, because our check-in process, people have to stay 6 feet apart in the morning when they're checking in to come into Transitions, those that don't have beds. So again, I think I've hit most of the things there. And it was fortunate we had a new PA system, and that PA system that speaks throughout the facility has really helped us get the word out to clients without having to have people bunch up for our normal meetings. So we were able to get on that PA system and tell people things they need to know. And that's pretty good. I think that's, it's been hard, but we've stayed open and we haven't had to turn people away.
Boy, that's a testament to your strong, not only your strong facility, your strong planning and leadership. Thank you for helping them that way. And then, Kimberly, I know you were working with kids, had lots of volunteers out reading to children when, boom, all of a sudden there was no school.
Yes. As of March, the week of March 11, all school activities, volunteers coming to the school was suspended. Things were a little bit chaotic because, of course, at that time, school was starting the process of shutting down, essentially. The MRC team, along with, of course, United Way of the Midlands, I have to, say that as well, I'm sorry, and community partners and the schools, we kind of convened in separate meetings because, of course, United Way of the Midlands, we're very into the community, and we wanted to know how we could provide services even though we were in the midst of this pandemic. So one of the initial conversations was ensuring that students received supplies. So what I did was I ordered supplies in the sense of like school supplies, something like a kid-friendly toy like Play-Doh, sidewalk, chalk, and I also ordered healthy snacks and had them shipped to the schools so that the schools can send these items home along with the educational packets that were created in the midst of kids being out of school. So that was very helpful, as many of the administrators shared with me, to be able to not only send the educational packets, but send, the school supplies and then, some healthy snacks home, non-perishable healthy snacks home to the students. We also did a book distribution. We were able to bring new books to the schools to go home with the educational packets, but also volunteers and members of the Midlands, United of the Midlands, went to some of the various feeding sites, especially one of the ones that really stick out in my mind is the one in Newberry, where there were hundreds of parents who came through to receive the free lunch meals for their children. And so that speaks to the need, the fact that, the meals were very important to the students during the day outside of the academics. So we were able to distribute new books to families during that time till we had no more to distribute. And then one of the big, the exciting points over the summer was that we had a few schools that housed the children of essential workers. And I was able to coordinate virtual tutoring, which is what we're moving into now due to the COVID-19. So I was able to kind of do a little model of the virtual tutoring. So I had 2 schools where we had volunteers who were assigned to a class, and those volunteers every week during the same time frame read to the class. And it was just such a joy because I would be on those meeting invites to see when the volunteer would pop up on the smart board, how the kids immediately knew to go over to the carpet and sit in their square so that they can social distance, of course. It was no more than 9 to 10 students in a class. And they were eager to listen to the story and engage to volunteer, but also had an opportunity to coordinate the one-on-one virtual tutoring by working with parents and the volunteer to come up with a happy medium as to the date and time each week that the child can connect. And so I would send out these virtual links to keep the students, whether they were in the classrooms or even those that were at home, kind of into the spirit of reading, because that's one of our primary focus is to cultivate a love of reading. So it was exciting to do those activities. It was different. I had to work through some kinks, especially when you're dealing with technology, but we were able to work through them and, provide the needed resources to the children that are served in our various schools and school districts.
Well, it sounds like you did not miss a beat from the shutdown day to today. So, and then Andre, you want to tackle that same question?
Yes, ma'am. So, like most folks, because we're not currently scheduling in-person gatherings, we had to cancel a lot of our on-site community awareness events, and the training events were held on a virtual platform. So as a response to COVID-19, we started a community conversation series where we were able to address a other topics that affect the youth community. A few of the first topics included how to help the kids respond to anxiety created by the pandemic, and also reminding families the importance of prioritizing their health and wellness. We hosted a panel of child healthcare experts that offered tips to our parents on how to navigate the added stress and worry that the coronavirus brought about. Another topic of discussion that we had was on the racial and social injustice that is plaguing our society right now. We had some prominent community members suggest ways to discuss with their children the purpose of some of those peaceful protests. So that was a way that we kind of redirected some of those conversations because we had to cancel the community awareness events, and they've been going pretty well thus far.
They certainly have, and I've had the opportunity to listen in on those, and you do a good job. So just a note for everyone out there, if you go to UA.org, United Way's website, and look at events, periodically you'll see those events pop up, and I'm sure you're welcome to go to any of them. So thank you all for the work you've already been doing. Now let's talk about what your plans are, how you're reaching out differently in the community, some things you're planning on changing upcoming, so we can talk in that direction. And Craig, you've done so much. You had to change on a dime with all of the things, and thank goodness you have not had to face a lot of folks with the COVID virus. What are you doing that maybe is a little different in the community? What do you have plans coming up that or you're making changes to address?
Well, I'll highlight, we've talked the food piece with Salvation Army, so let's skip that and move on to the clinic piece. Eau Claire Health Cooperative, the cooperative health, still runs their clinic, and they have run their homeless clinic on site through this entire COVID process. The nurse practitioner is here through the week. She's working with those that are sick. So right there, there's easy access healthcare, and the people actually come into her office and her clinic site. She's in full PPE, but that has continued very successfully, and we're thankful for that. So our clinic piece, obviously, if the nurse practitioner cannot handle it, she refers them within the Eau Claire system. And obviously, if it's emergent, they'll go immediately to the hospital in an ambulance or whatever. So that the health piece has continued well. The beds are there. The Columbia Area Mental Health Counselor has remained on site throughout the entire crisis. So clients can get mental health needs. He does assessments, sends and refers people over to Colonial Drive to the main building where they can get help as well. Sometimes that's a little more limited, but the health process needs to continue both physically and in mental health aspects. So they have, we're encouraged by that piece, and we're glad. I'll talk a minute about the actual jobs piece. Jobs have been a problem. Obviously, the economy shut down, and a lot of the food service industry jobs where our clients are able to work collapsed. They're starting to rebound now, but our jobs case manager was working nonstop to help people with unemployment, help people file taxes so they could get their checks from the government. If you had not filed your taxes, that was problematic for you to get a check. So we were fighting through that one, and then getting people new jobs and trying to move some people away from the food service sector to other jobs that might be more COVID survivable. And of course, retraining homeless folks is not always the easiest thing. But that's been, the jobs piece has been really tough, and the staff's done well with that. The case managers have worked with people one-on-one to place them somewhere else. They've had to move to phones. Often they're not close in their cubicles anymore talking, so they keep a 6-foot distance. They often do sessions outside as well. So there are differences there. We continue to do our job. We continue to seek people who are employers who are willing to hire folks. That's still a real need right now as people try to bounce back and the economy starts to recover.
Okay, thank you. That is a tough situation for everyone with jobs, and I would think that your group, if as you are listening out there, if you know folks who have jobs, let them know about Craig and his work there at Transitions. That he has very good people to employ, and we'd like to see that get back faster than it is right now. So I think next we could maybe talk to Kimberly again. What's on tap for the future here?
Well, for one thing, we have to be very careful. We have to keep ourselves and our volunteers safe. And being that district policy, majority of them are mandating that volunteers are not allowed in the schools right now. So what we're doing is we're going to continue our virtual tutoring model. We will offer virtual one-on-one tutoring, meaning, once a week you will receive a link to that child's home device or the school device, and we're looking more so towards the school device to read to that child one-on-one. We also have the classroom reading, meaning, again, as I shared before, you will be assigned a teacher, and every week, once a week, during the 20 to 30 minute time frame that's designated by the teacher, you will click on your link and magically appear on the classroom smart board. And we still don't want to have companies feel that they can't contribute. Some people can't dedicate the once a week. So we still would like to work with companies who would like to dedicate a day of doing guest reading, virtual guest reading, which is similar to the classroom reading. So those are the three opportunities that we have. It is all virtual, but we still plan on committing to working with our students in that platform. We're also, going to be creative and work with the school to deliver parent engagement opportunities, even if we have to do it in small sectors, because we've had in the past parent engagement event where we had 100 people in the room, and we know we can't do that now. So although it'd be virtual, or we'll have to come up with some other savvy way to meet with parents, maybe in small groups so that they can social distance. We'll work with the school to kind of come up with a plan with that, because of course, everything will be contingent upon the school, the size, and the happy medium of what we can deliver safely. And we still plan on doing our book distribution, so that our children can continue to build their library of books at home.
Okay, thank you. And we'll ask our Always United members to help in any way that you need. Thank you so much. And now, Andre, what's on tap for you? How are you reaching out now?
Yes, ma'am. So a huge portion of the work that I do with Resilient Richland focuses on 29203 area code, North Columbia. United Way is partnered with Children's Trust South Carolina to develop an Empower Action Prevention Plan with the intent of incorporating protective factors for families and children to prevent maltreatment. And we've continued to make progress on the plan. 3 strategies that we focus on thus far have been peer support, where we recruit community advocates to host peer support groups to assist families with stress management, and create platforms for social and emotional intervention, and also offer information and referrals to services and resources within the community. Another strategy has been around youth mentoring, where we look to engage with high school students with the life skills curriculum that caters towards cultural and career exploration and create opportunities to build relationships with caring, supportive adults. The program will also include exposure to Juvenile Justice Jeopardy, which is a game that we have here where we host organizations that with youth participation, so we can kind of test their level of understanding of the juvenile justice system. It's meant to help them navigate their interactions with their peers as well as law enforcement, and encourage positive outcomes and avoid negative consequences. One of the third strategies that we have for the Empower Action Plan is centered around parental engagement, where we look to fund a cycle of Triple P, Positive Parenting Program, which is a family support program that is designed to treat and prevent behavioral and emotional problems within children and teenagers. and help to create the family atmosphere that kind of encourages those kids to reach their full potential. In partnership with both Children's Trust as well as Prisma, we were able to help families address, the excessive hardships created by the pandemic, with the gift card giveaway for residents to purchase basic and emergency needs from Food Line as well as Dollar General. And through a national night out, we were able to distribute book bags and additional school supplies for the community as well. So those are things that we just continue to build on as we look towards the future.
Important work. Thank you for that. And I guess my final question to all of you is about what can the viewers of this program do to help the panel? And what opportunities are there, and in almost your wish list. So let's see, Kimberly, you go first.
Okay, awesome. Well, one thing I can share with you is that we always need volunteers. Last school term, we were able to help 691 students and 434 volunteers served under the United Way of the Midlands Reading Consortium. This year, we hope to increase those numbers because, again, this is a very critical time. Students are, for the most part, doing virtual learning, and it's different than being in the classroom. So we want to make sure that these children have all the support that they need, and that's where our volunteers come in. You will be trained. We're not just going to push you out there and say, go do it. We do have, consultants who will train you on the basic components of not only of reading and literacy skills, but also even how to engage students virtually, because it is different. It may feel a little different in the beginning, but you'll get the hang of it, because I felt comfortable over the summer after engaging students. So we need volunteers. And if anyone is interested, you are always welcome to go to ua.org/MRC. MRC page will pop up, and you'll see all the information about the schools and what we're looking to do this school year. Also, to donate. We have, several companies, and it's not just including just these companies. We have a multitude of companies, but the ones that kind of come to mind are Blue Cross, Colonial Life, Kraft, Southeastern Freight, Wells Fargo. They not only allow their staff to volunteer, but they've done book drives and donate, monies, because of course, it costs to train our volunteers. It costs for us to do background checks because we don't want anyone in our schools without having at least a national background check, just to ensure that children are safe, even though it's virtual. We still want to follow that protocol, and even to just provide the additional resources to the student and the parent engagement, all of that. Everything comes from the donations and the resources that United Way of the Midlands have galvanized. So, that's just to name a few of those companies who have pretty much embraced the school and, have provided those resources to them. And that's about it. If you
well, we appreciate the work that you're doing, and know that the volunteer opportunities will be there, and people are really. I know I've talked to several people who have been reading in schools for years, and I'm encouraging them to come and look at doing a virtual kind of tutoring with you. So, and let's see, Andre, how can we help you?
You brought up on me. I think it came to me, Claudia. I would say advocate, help create awareness if you can, and also give if you can. Volunteer opportunities. I think future volunteer opportunities may be available once we're able to implement the youth mentoring program for guest speakers to share life skill topics that they would be comfortable presenting to a group of mentees. So I think the opportunity to do that in the future may present itself, and just ask everyone to be open to doing that, and obviously continue to advocate and give if you can. Thank you, ma'am.
Okay, well, thank you. And our Always United group has had mentors in the past with a program with our YLS group. So I would imagine that you just let us know, yes, and we'll get back with you. So looking forward to that. Cheryl?
Okay, I would say that Well Partners is an organization with many community partners, partnerships are critical that allow us to provide these services. Our greatest challenge is staying ahead of the curve when it comes to funding. So, looking for grant opportunities, foundations. So, as a United Way, we're very aggressive in doing the work within our walls, but we also ask if any of you know of organizations, foundations, individuals that are interested in the work that we do, providing comprehensive eye and dental care to our uninsured and underinsured population. Share that information with me, and perhaps we could reach out to them. And then also, if you have a dentist or an optometrist or an ophthalmologist that may be interested in volunteering, make them aware that this is a program in our community that accepts volunteers on that level. And then, as far as the dental hygiene kits that we provide to each of our patients, we do have a need for that, whether it's toothpaste, dental floss, or toothbrush. We provide them with this at every visit. So that could be a potential where you can get involved as well.
Well, thank you, Cheryl. And we hear that, and I think maybe there's some tooth fairies in the bunch that might be able to help you in the future. And we're working on a couple things like that with Always United. And Craig, please, I know that you've got some needs there that we might be able to help you with.
Well, we love volunteers, Claudia, and during the crisis, the volunteer base has diminished, especially initially. It's starting to bounce back some. There are the normal volunteer opportunities. The kitchen is open. What we have done is put people in the kitchen area, filling the boxes away from the clients so that they're not exposed to the clients who come by a plexiglass shield and they're handed their box through the slit. So we've actually been able to limit exposure to folks there. And of course, you keep your distances and you wear masks. So if you're interested in serving food, that option is still there. Teaching classes, we've lost a lot of teachers. School groups that would come in from the colleges to volunteer are not. So we're having to replace groups. And just if you've got a life skill desire to teach people, we'll put you in a very small class. So it's not going to be a big class. You'll be with 4 people. We completed a jobs program that had usually about 2 to 4 people in the classroom so that they were spread out. But we had the volunteers willing to come in. And we'll start that iteration again next week and repeat the jobs program as well. So there are opportunities. You can look at transitionssc.org and get Catherine Beltran's contact information there should you want to volunteer to do something. I'd also just encourage donations of clothing. You know, if you're at home and you're tired of looking at your closet, so you got clothes in there that need to go, now's a good time. Summer's almost over, so maybe you want to part with some of those clothes. We'd certainly be happy to take those off your hands in the form of a donation and can give you a tax slip if you're interested in that as well. The Inclement Weather Center will open on 1 November, and we always need volunteers for it. So I'm praying that by 1 November, the numbers have gone down a little bit in COVID. Regardless, we'll be social distancing and wearing masks. So, I mean, that will open as it always has, and is a great opportunity to serve meals or help check the clients in or do stuff there. So if that's of interest, starting 1 November, weather dependent, if it's 40 degrees or colder, that option would be available as well. And then finally, what kind of CEO would I be if I didn't mention just give money? You know, the United Way campaign's kicking off, so you could give money there. Always United has part of that campaign. There's always a way to donate if you don't feel comfortable actually coming to a facility. So thank you for all that you do. Thank you.
Well, and thank you, Greg. We really appreciate all of you being part of this. If you have questions, anyone who's watching this afterwards, you can always send an email to alwaysunited.org. and go online to ua.org. We appreciate the information. You guys do a lot of good work in the community, and it's you mentioned so many different partners through all of this. That's something that United Way works hard to convene the people and the resources to make great change in our community. And we know that each and every one of you on this panel work hard at that every day, and we thank you so much. And I see one question. Whoops. Let's see if I can show that to you. Zach wonders, could student organizations at USC get involved with MRC in the same way that you requested companies get involved? There you go, Kimberly.
Yes, in fact, we have a partnership with USC. We've had this partnership for 6 years, whereas I've had interns. This year I'm not doing interns, but I do have the work study. I do work with Zara Carly. Carly Zare, I'm sorry. She's helped me. She's a student at USC. She's helped me to recruit volunteers. So yes, please send me an email at khouse@ua.org. That's KHOUSE@ua.org, UWAY.org, and just give me a little background about your organization. We'll schedule a virtual meeting to kind of give you more details, because of course, things with the college students, I like to be a little bit more detailed, especially if they're recruiting other members. So of course, Zach, look forward to hearing from you.
Okay. And again, I thank you all, and I think we're ready to turn this back over to Liz and Adena to wrap up some things about future programs that we're doing and how you can get more information. And again, thank you all very much.
Thank you.
Thank you.
All right. Hello again. Thank you to all the panelists. I'm sure everybody out there was really interested in meeting people in person and finding out what we can do during the pandemic to help in our community. I also want to thank AARP Driver Safety again for sponsoring Always United. And I want to thank everybody who attended today and remind them that we're going to be having more in the near future. The next Tuesday talk is going to be September 22nd. They're always at noon. They're always free. And this one next one's going to be very interesting. It's going to be advocating for South Carolina's vulnerable adults. There is a guardian ad litem program where people can be appointed to represent vulnerable adults in courtroom situations to help them get the care they need. So thank you again. Adena, do you want to come on and add anything about some of our other programs?
Hello. No, I do not have anything in particular. If you Always United did host this event, and so if you are interested in joining Always United, you can go on to the ua.org website and find out more information about Always United there, and also fill out any information to register and become a member. So yeah, thank you everybody, and thank you for coming.
Okay, so be on the alert, look at the website and sign up for the next Tuesday talk.
Okay, thank you.
All right, y'all have a good day. Bye-bye.